Today we will be learning some of the vocabulary involved in preoperative procedures. We will start by watching a short video. In this video, we will introduce you to the pre-op procedures in English. We will provide specific vocabulary you will need while performing pre-op procedures or discussing these procedures with your colleagues. We hope that these clips and the following definitions will help you to learn the vocabulary within the context that you'll use it. Following the clips and vocabulary, you'll be asked some questions to give you the opportunity to test your knowledge. Let's begin.
Hi, I'm Tracy. I'm your registered nurse. I'll be taking care of you today. Can I see your armband, please?
Yeah.
During your admission to the pre-op holding area, you'll be asked many of the same questions that you have been asked before, such as your identity, type of surgery, and the location of your surgery. This might be frustrating, but it's an important part of Duke's safety checks. We will update your medical history with any additional information, verify your medications, and ask you the last time you had anything to eat or drink, and other important details particular to your surgery. You'll receive a brief physical exam that includes taking your temperature and vital signs, which include a cardiac monitor that allows us to monitor your heart, a blood pressure cuff that will help us watch your blood pressure throughout the day, and a pulse oximeter that gives us information on how well you're breathing and how much oxygen is in your blood. Once these are complete and we've confirmed all of your information, we'll insert your IV, which is a plastic tube used to carry fluids and medications. This will help keep you hydrated and be used to administer medications. Our goal is to make this pre-op experience as painless and stress-free as possible.
When explaining the upcoming procedure, please remember that your patient's comfort is important. During your explanation, try to be patient, calm, and encouraging, even when your patient seems to possess none of these qualities. Make sure to speak slowly as you walk them through the procedure, pausing to allow for the patient's questions. Take the time to answer all their questions carefully. If the use of medical terminology is necessary to explain what you are doing or what is happening in the procedure, common terms should also be provided. For example, when you explain that a patient will be under anesthesia, follow this with a short description. We will ask you to breathe as you count back from 100. As the anesthesia is administered, you will fall asleep. You will be asleep during the entire procedure and unable to feel anything. It is up to you to make sure the patient is confident and relaxed as they enter their procedure.
Once your questions have been answered, you'll then review and sign a surgical consent form, if you haven't already done so, giving the surgeon permission to perform surgery. Anesthesia is a combination of medicines and techniques that make you comfortable and safe during your surgery. Sometimes this involves numbing up parts of your body or putting you to sleep for your surgery. Your anesthesiologist or a member of his or her team will come by to see you prior to your surgery to talk about available options for anesthesia and what would be the best for you and your specific surgery, as well as go over what the recovery period from anesthesia will be like. When you feel comfortable that your questions have been answered, you'll review and sign a consent form allowing the anesthesia team to care for you during your surgery. Once all teams have spoken with you, 2 members of our staff will provide one last safety check, verifying your name, birth date, any allergies, and your surgical location. They'll then ensure your consent forms are signed and complete. Staff will also check to be certain that the surgeon has signed an updated history and physical information sheet on the day of surgery. Once all of this is completed, your red hat will be changed to a blue hat, and you'll be ready for surgery.
Now let's go through some of the vocabulary that you've just been introduced to. Nil by mouth, or NBM. This refers to the period right before surgery during which a patient is not allowed to eat. This is sometimes also called NPO, nil per os. The vital signs. These include temperature, pulse, respiratory rate, and blood pressure. Cardiac monitor. A device that shows the electrical and pressure waveforms of the cardiovascular system for measurement and treatment. the blood pressure cuff or sphygmomanometer, an instrument used for measuring blood pressure, especially arterial blood pressure. Pulse oximeter. Pulse oximetry is a test used to measure the oxygen level of the blood. It's an easy, painless measure of how well oxygen is being sent to parts of your body furthest from your heart, such as your arms and legs. The IV, standing for intravenous, meaning within the vein. IV therapy is the infusion of liquid substances directly into a vein. To administer medication. Administer is the professional word for give. The surgical consent form, a form signed by the patient prior to the medical procedure to confirm that they agree to the procedure and are aware of any risks that might be involved. Anesthesiologist or anesthetist, a physician trained in anesthesia and perioperative medicine. An anesthesiologist helps ensure the safety of patients undergoing surgery by trying to prevent the pain and distress they would otherwise experience. Finally, we'd like to ask you some questions to check whether you've understood the content of this video.